Hey guys, Dr. Gaeta here. I'm here with Perry. Perry, how you doing today?
Doing well, thank you.
We grabbed Perry out of the treatment room and decided to let him tell a little bit about his journey with us. Perry, how long have you been coming to us?
I started my treatment in 2012 at the suggestion of a friend. I had actually seen two doctors in the past with back pain and sciatica. It had gotten to the point where I couldn't even work hardly. I had to take half days just to make it through the day. The doctors would give me muscle relaxants and pain medication.
Right.
And basically my friend said there's more to life than that. So I came to see Southern States, and they gave me a good plan to where I would work through things, and told me it wouldn't be instant, but it would be worth it. So with that said, 2 months later, it was night and day.
Awesome.
I did the spinal immobilization, spinal decompression.
Right.
I did the other things you would have me do, the adjustments, the exercises, stretches, and again, in 2 months, it was night and day with no medication.
That's awesome. You know, you said a few points there that I always try to come across on these videos, Per. One, you know, when you're choosing the option of sort of physical care, it's never an overnight type thing. You have to work on it, number one. Number two, you know, you've got to be consistent with it, you know, and that's usually the big thing for people to understand is to get sort of relief, and also long-lasting relief. They have to be somewhat consistent with care. And you know, a lot of people don't want to take, you know, muscle relaxers and all that sort of stuff for many reasons. So good. So overall, after your initial pain with low back, things are better. But once in a while, you get a bump up, and you're a very physical guy. You do lots of exercise, and your work is very physically demanding.
It's
right?
a change of life, basically.
Yeah.
Get to where I needed to be with health.
Yeah, that's a good point. That's a really good point. So when you do get in a little bit of a mess with your low back or shoulder or whatever, you know, we kind of fix you up a little bit. And
I rely on you to put me back together again. Yeah, that's very, very true. You know, I got involved with martial arts and with various forms of exercise. And honestly, you knocked the rust off of several things. And when I knock the rust off of these joints, I come to see you, and you make things better where I can, you know, proceed and excel in things. It's not just that anybody could go out there and do any particular one exercise without, you know, it's a combination of things.
Right.
So I'm going to say, you know, yes, I worked out and I did things and I did my martial arts, but also too I had to have that chiropractic component as well.
Well, good.
If I didn't have it all put together, you know, I wouldn't be where I am today.
And that's a great point, Perry. Is it is a combination of a lot of different things, which is and the most important thing I think I just heard you say is it is a lifestyle choice, right? And there's many aspects of that. Well, I'm glad you do well with us. I'm glad that it's part of what you do to maintain your health. Would you recommend our treatments and care to people that you know?
Very much so. I would say if it wasn't for the decompression that I had really started out with, who knows? I might have had to have back surgery. I know that I wouldn't have wanted to be on medication for, you know, the past 5-7 years that I've been actually seeing you guys.
Right.
Definitely, it's worth it. It's worth a try. But you have to understand it's a commitment for you too. You just can't expect to come in here and let the doctor do everything. Right. It's something that's, it truly is. It's something that I would say as a patient that I had to commit to.
And we got to do our homework, right?
That's right. You got to do your homework, but everything's worth it.
That's right. Well, I'm glad, Per. Well, thanks for sharing your story. Hopefully this helps other people out in making, understanding their options, understanding what options there are to get better, and them making an educated decision on what they want to do with their back. So again, thank you, and keep on doing well.
Thank you.
Thanks.